Hi there, I believe it's recording now. Welcome to part 2 of SARS CoV-2 adjunct therapies for prevention and phase 1 infection. As I mentioned, this is part 2. We have a lot to cover. I'm gonna try to go as fast as I can while keeping the flow of the information that we have to cover. As a quick review, in part 1, we talked about 3 main things. We talked about what's happening during a COVID infection. We talked about the immune system. And before all that, we went over some definitions right here on the top of the slide. Just by way of review, the COVID infection, the things that we talked about, we talked about the 3 phases of the infection, basically based off of symptoms or ventilation requirements. So phase 1 would be not requiring any oxygen. Phase 2 would be need for supplemental oxygen, and phase 3 would be need for mechanical ventilation, being in the ICU, being intubated. We talked about the cytokine storm of your immune system is what is actually, that's what's actually killing people. And the COVID infection is more of what's triggering that. And part of the mechanism there is the virus suppresses the interferon production in your immune system. And the interferon production is just one of the things that interferes with viral replication. So you get this uninhibited viral replication, increased viral loads, and eventually the cytokine storm, eventually the immune system response catches up. But in the real sense of things, it's not catching up. It's just it's way too late to the game. So then we talked about the infection anatomy. The ACE2 receptors are what the spike protein is binding to, and the ACE2 receptors are most present in the bowel, in the lungs. Also, I didn't mention they're the heart tissue, very present in the heart tissue, in your vasculature as well. But because they're present in the lungs and this can be breathed in, that's where this is mostly manifesting. But like we mentioned, it can manifest in other symptoms. For example, diarrhea. If you are exposed in your GI tract, the body's natural immune response would be diarrhea to rid that out. So part of it depends on how you are exposed. We also talked about the immune system. We talked about the different some of the different facets of your immune system. We talked about the structural mechanical, the innate part, the active part, and the spirituality part. We focused in on the innate immune system, the innate part of the immune system, more of the non-specific broad spectrum part. Again, all 4 of these work together as a team in different things. And we mentioned about the interferon suppression in phase 1. Early treatment is really what is key here. There's that window of opportunity before the interferon is suppressed. The interferon is keeping down that viral replication, and all of the therapies that we're going to look at either keeping down that replication through different means or lowering your exposure load from the replication, basically helping your body halt the virus from replicating as fast or getting some of it out of your system. So that is really what we're going to talk about, and that's really the big, huge missing key area in just all of our mainstream efforts to combat this coronavirus. And that's often missing in other settings too. For example, the pre-op surgical setting, much of the infection prevention efforts that are carried out at home and in the pre-op unit in the hospital before someone goes into surgery are focused on decreasing the exposure and not necessarily increasing or optimizing the intrinsic immunity. And decreasing exposure is very important. It's just one of the things that we've gotten hyper focused on, and at the expense of leaving out the intrinsic immunity that can be optimized. So let's get into part 2, which is the actual therapies that are going to help us increase and optimize that intrinsic immunity. And for us to understand that a little bit better, we're going to watch this quick little video that shows some of the complexity of the immune system, but also how there's many different players, many different pieces that keep your immune system functioning optimally. So this is an immune system analogy. I just found this online, but I thought it was working pretty well. So think of the body like being a country, and the people in the country are the cells in the body. So the organs of your body can be thought of as different states or territories. Pancreas, your gut, liver, lungs, brain, heart. The immune system is the body's defense force. The first line of defense, this would be the mucosal membranes. This is what we talked about. That would kind of be like the surface barriers. That decreases your exposure load. That keeps the exposure out. We have problems. There we go. So pathogens. Again, this is a big analogy. So pathogens, they're likened to foreign criminals. There's various types of pathogens, as we can see in this analogy. And they try to get into the body in different ways, different exposure routes. The second line of the defense is the innate immunity. The neutrophils, monocytes, short-acting, long-acting. These are non-specific. They're non-adaptive, meaning they can't remember the exact type of pathogen. They respond quickly to contain the situation. And again, with the interferon suppression that happens with COVID, with SARS CoV-2, that quick containment of the situation is vitally important. So the innate immune system really kind of takes or notes some of the characteristics of the infecting pathogen, and it communicates them to the third line of defense, your adaptive immune system. And that would be the helper T cells. Now, the helper T cells activate some of the B lymphocytes. So you can see there's a lot of communication happening within your immune system. And then there's specific antibodies that are created to combat the specific pathogens. Now, the antibodies are, again, the third line of defense. So we really are going to be focusing on this second line of defense. How do we get that optimal first internal response to the point where it's doing an effective job before the interferon suppression happens, before the huge amounts of viral replication are occurring? So each one of these antibodies is used to specifically combat pathogen, and that's wraps up the immune system analogy. So just as a quick, that was presented just as a quick review. Moving on to the treatments and adjunct therapies. As a whole, we talked about phase 1, phase 2, and phase 3, and that's just related to symptoms of how much oxygen you're needing. And how much oxygen you're needing is related to how much, how effective and productive your lungs are ventilating. How much are they able to absorb the oxygen through diffusion and get the carbon dioxide out through exhaling. So these treatments are most effective in phase 1 because you're still haven't got to the point where your immune system is attacking your lung function to the point that you need oxygen. So as a whole, all of the adjunct therapies, all of the additional treatments, or you could say natural remedies, all of those as a whole, there's way more than we can cover today. We're just covering a very small part. You can see our little pie chart here. We're just going to cover this small sliver of red, basically, and there's so much more that we don't have time to cover. Part of my selection criteria for these studies that we're going to look at, I chose some of the natural remedies, some of the adjunct therapies that have been most studied. I chose ones that have been most overlooked. I chose ones that are most accessible to the average person. They're not they're not costly. They're not 100% dependent on the supply chain functioning. We've saw major issues with that. Also, the other selection criteria, they are most effective for phase 1. So a lot of the things that we're going to look at are not what you would want to be using in phase 2 or phase 3, because the priorities of care change when your lungs are not working and so forth. So these are most effective for phase 1, and in many cases these would be very less effective, some of them not effective at all if you're trying to use them in phase 3, because phase 3 is the phase where the immune system has gone awry and it's having too large of a response too late. And so these things have to be done early, before you have COVID, or some of them right in that phase 1 before you need oxygen. They have to be done in those early phases, phase 1 or prior to infection, in order to get your immune system to the place where it is optimal, where it can mount that adequate, quick response in phase 1 and overcome the virus before you progress to the place where you would need oxygen, where you would need to be hospitalized and be on a ventilator. And many of these are randomized controlled trials, although we'll talk a little bit more about that. So not all of these are randomized controlled trials. Randomized controlled trials are the gold standard when a medication has to go through FDA review and approval to bring it to the market. And it really is it's where you have two groups of participants, the control group and the test group, and you're comparing the results between those two groups with one intervention across both groups. So we're just looking at a very small portion of these therapies. There's a ton more than we can cover. These are what we are going to cover, and we're only going to be able to cover a little bit of each one of these as well. So we're going to look at fresh air and what that does to the white blood cell activating enzymes. We're going to look at humidified essential oil air. I may have misspelled that. The essential oil being humidified and breathed into the lungs, where those ACE2 receptors are, where the tissue is most susceptible to an infection taking place and the COVID pneumonia occurring. We're going to look at rest and how that impacts your immune system. We're going to look at daily rest, getting enough sleep. We're going to look at weekly rest. We're also going to look at sleep robbers, some of the biggest things that will take away your immune system function by taking away your sleep. We're going to briefly touch on nutrition. We're going to spend some time on heat therapy. We're going to look at hot air and saunas. And hopefully by the end of everything that we go through, you're gonna realize that I'm not full of hot air. It's just the studies are simple. The studies are not well known because really, frankly, they don't make a lot of money. You're not going to be able to patent fresh air for someone and sell fresh air to someone, unless you live in really large polluted cities where fresh air is hard to come by. But in our state, you get what I'm saying. There's not a shortage of these simple remedies, and thus people, they're not money makers. So there's no reason to really be selling them or pumping them. We're going to look at exercise and immunity. We're going to look at iodine switching to decrease the viral load that you have. We're going to look at nutraceutical profiles, and that's just fancy term for vitamins. And we're going to briefly look at trusting in the divine creator. So we'll get right into it. I just have to switch screens here. So we can see here. So the first thing that we're going to look at is the fresh air aspect. These, we're going to look at a few studies. These studies were done in Japan. The effect of forest bathing trips on human immune function. Forest bathing is spending time out in the forest, breathing fresh air. They took a look at the natural killer cells and the enzymes, the 4 or 5 enzymes that help activate the natural killer cell function. And in this study, they had people stay for 3 days, 3-day, 2-night trip to the forest area, and they measured the natural killer cell enzymes, not the natural killer cells themselves, but the enzymes that activate the natural killer cells. They measured them before the trip, and then they measured them after the trip on day 2, day 3, day 7, and day 30. And again, an increase in these enzymes would result in an increase in the natural killer cell activity. So the increased natural killer cell activity lasted for more than 30 days after the trip, suggesting that forest bathing trip once a month would enable individuals to maintain higher levels of natural killer cell activity. And this, in contrast, the visit to the city as a tourist did not increase natural killer cell activity. This was a randomized controlled trial in that they had one group, but they had the group spend a certain amount of time in the forest, and then later a certain amount of time in the city. And so the findings indicate that forest bathing trips resulted in an increase in natural killer activity, which was mediated by an increase in the number of natural killer cells and the levels of intercellular granulysin, perforin, and granzymes AB. Those are the enzymes that activate the natural killer cells. So there are also actually increased levels of the natural killer cells themselves. So not just the activity of the cells, but the number of cells themselves were increased. And we look down here. These are the 4 different enzymes that they were measuring. You can look right here. The dark gray is the level before, meaning before they went and spent the 3 days in the forest. This second bar with the diagonal lines, that was day 1, and day 2 is the solid black bar. So here we get a there's so many so many graphs here with the data. So this is what what I was going to show you here. We have an increase. We have the before, we have day 1, day 2, day 7, day 30. So you can see day 1, day 2, and at day 7, it's still elevated. Day 30, it's come down some, but still higher than initial. So, and this is the natural killer cell activity, and this is the natural killer cells, the actual percent of them. So an increase in both the activity and the percent, and you can see it lasts for up to day 7 before it actually starts to come down. And this is still elevated above the initial, but definitely not as much, not as elevated as at day 7. So essentially, every 7 days, if you can spend time out in nature, in the forest, doing some deep breathing, that's really the takeaway from this natural remedy. Now, they did more. They did forest bathing enhances natural killer activity and expression of anti-cancer proteins. We're not going to go through this one, but this was also done in Japan by the same researchers. They wanted to look into it further, and effects of phytoncide from trees on human natural killer cell function. This one was actually not done in the forest. They actually was just talking about this phytoncide, which is another name of essential oils. They took essential oils, they aerosolized or humidified them, and they took the group, they had them stay in an urban hotel for 3 nights. They had aromatic volatile substances that were produced by vaporizing cypress oil. And blood samples, similar to the prior studies, blood samples were taken before, blood samples were taken on the last day. They also did urine samples, and same thing, the exposure significantly increased natural killer cell activity and the percentage of natural killer cells and all four of these other activating enzymes. So if you can't get outside, then you could buy some essential oils and you could breathe them. Now that's dependent on the supply chain, but getting outside and breathing fresh air is not. So one of the things that I really like about where I work at St. Pete's Hospital in Olympia, we have all these trees. You can see all these trees here on our campus. It's there's hundreds of trees, and there's even all these little ornamental gardens here. And that's one thing I'm trying to do more of, is get outside when I have a break to breathe those fresh aromas in and get my natural killer cells working. That's one of the great things about living here in Washington, the Evergreen State. However, it's just like all of these therapies, it's easier said than done. And many of these things I'm presenting, I'm trying to increase my adherence to them, or my implementation of them too. So we looked at the forest bathing. We're going to take a look. We talked about the humidified essential oil air. We're going to look at rest. But before that, we have one more study to look at. Go back to our screen. This particular study was from the British Medical Journal. Parachute use to prevent death and major trauma when jumping from an aircraft. Randomized controlled trial. This doesn't have anything to do with what we're talking about as far as therapies, except for the sense that the whole purpose of this, they wrote this up and it was published in the British Medical Journal. The whole purpose of this parachute trial they are using professional British medical journal satire to highlight some of the limitations of randomized controlled trials. They were saying that they believe randomized controlled studies are the gold standard. And if you read through this, it's pretty interesting. They're saying parachutes need a randomized controlled trial to basically prove that they're effective in preventing trauma and death. Now they're highlighting the illogicalness of people who say, oh well, with natural remedies, oh well, that doesn't work. That needs to be studied. There's no randomized controlled trials on that. There's no proof that that works. Well, in the case of an airplane, when your airplane's going down and you need to use a parachute's your only option. You need to get off the plane. You're not going to be saying, oh, I need a randomized controlled trial study to show me that the parachute's going to work. And similar to the pandemic that we're in, when we're in the worst pandemic that we've seen in my lifetime, we don't need we don't need further research to be done on some of these things that are already proven to be effective for optimizing our immune system. Some of them have not been studied out with COVID specifically, but we don't have the luxury of time for that. Just like if you're on an airplane, and it's going down, you don't have the luxury of time to do studies to see if the parachutes work in a test group and a control group. And by the way, the article talks about the challenges of even getting a control group for this, because the control group would mean they're jumping out of the airplane without parachutes and dying when they hit the ground. And then you would have the statistical and the randomized controlled trial data that you need to prove on paper with the gold standard of research that parachutes do work. But do we need that? Absolutely not. Do we need that in the case of natural remedies? Absolutely not. So we will move on. We'll move on to heat therapy, the effects of air temperature and relative humidity on coronavirus survival on surfaces. Now, this one is specifically looking at coronavirus, how long it survives. The one thing we're interested here is viruses were inactivated more rapidly at 40 degrees Celsius than 20 degrees Celsius. 40 degrees Celsius that would be an extremely high fever. When I had, the last time I had a fever was when I had COVID, and my temperature was 38.5, which was 102.4, I believe. So this would be temperature of, well above what you would want. However, they're more rapidly inactivated, meaning the viruses are not viable at this temperature. So they're more rapidly not viable at 40 degrees, but as you approach 40 degrees, they become less and less viable and more rapidly inactivated. And then once you reach 40, that's when they are the most rapidly inactivated. So all that to say that we're going to look at fever in just a minute, and this comes into play with fever. The fever actually helps slow the viral replication, and using fever reducers in any type of infection is not recommended, in my professional opinion. Now we'll go on and we'll look at fever management, evidence versus current practice. This highlights how the current practice is behind what the evidence shows. It says this article will discuss the significant contrast between current concepts of practice for fever management on one hand and the scientific evidence against such concepts and practices. So right now, especially in the, I would say the pediatrician world, giving Tylenol to kids whenever they have any type of fever, even a low-grade fever, is the standard practice. Now, I tend to take a different approach. I am not against using a fever reducer. I am against using it all the time, anytime, without actually thinking through what's happening. One of my daughters just had a fever last 2 nights ago, and we used a fever reducer when her fever got to a point where we were a little uncomfortable. But when it was lower, and after the fever reducer brought it down some, we didn't continue giving more to make it go away 100%. We let it ride. We let the fever ride out at an acceptable level. So the concept is that fever phobia, an exaggerated fear of fever in children, is commonly among parents. Parents have a poor understanding of the fever and little or no information about its beneficial role in disease. A lot of us, not just parents, a lot of us have no idea of what the beneficial role of fever is. So there are some risks if the fever gets too high. However, if you're monitoring it closely, there's no reason to have a fever phobia. So with fever, unlike hyperthermia, body temperature is well regulated by the hypothalamic set point that balances heat production and heat loss so effectively that the temperature does not climb up relentlessly and does not exceed the upper limit of 42 degrees Celsius. With this upper range, 40 to 42 degrees Celsius, there's no evidence that fever is injurious to tissue. About 20% of the children seen in an emergency room have temperatures over 40 degrees, but they usually have a full recovery. So even if the temperature gets to 40 degrees, they usually have a recovery. This is in general. This is not specifically speaking about COVID. This is just with any infection. If there is morbidity or mortality, it is due to underlying disease, not the fever itself, is what it's saying. The associated fever may well be protective. So fever has a protective effect, and part of it has to do with the study that we looked over here. The virus is not being viable after 40 degrees. So if you got COVID and you could get the location that the COVID infection is happening as hot as possible without getting the rest of your body too hot, that is one of the ideal situations for utilizing heat as a therapy. And the body naturally uses heat as a therapy with the fever response. We oftentimes dampen that down with a fever reducer. Now, it's obviously going to be important if you do have a fever to monitor it closely and not let it get too high where it could be causing seizures or things like that. But you can see right here with 40 to 42 degrees, no evidence that the fever is injurious. So if we are to treat COVID with heat effectively, I shouldn't say treat, if we're going to use an additional therapy to treat COVID, heat is one of the most effective things. This is most effective, not just in phase 1 once you are infected. Once you are infected, it's also very effective from a preventative standpoint. So how do you deliver the heat? Well, the heat delivery really depends on whether you're doing it for prevention or whether you're doing it after you already have symptoms, or whether and it depends on what your symptoms are, where they're located. Are they located in your chest? Is the chest where the main area of infection is? That would dictate how you're going to deliver the heat, whether you're going to deliver it through with water in a hot bath. Also, if you have a fever or if you don't have a fever, that would also determine how you're going to deliver the heat, because you don't want the body to be overheated. If you have a fever, you want to use localized heat in the area of infection, and you want to use other means to cool, to keep the blood somewhat cool so it's not getting too hot. So there's a lot of different ways to do that depending on if the person's infected or if it's infected, or if it's being done for prevention, or if infection is in the lungs or in the bronchus. Localized heat on the lungs with cool on the heat, cool on the head, cool on the feet is one way to do it. You can do it with a fomentation. You can do it with a thermophore. That's one of the easiest things. That's just a brand name for a heating pad that gets really, really hot. Anyway, there's lots of different ways to do it, but we're going to look at fever and the thermal regulation of immunity. The immune system feels the heat. This article discusses the emerging evidence that suggests the adrenergic signaling pathway associated with thermogenesis shape immune cell function. So part of the fever is not just to make a really inhospitable environment for the virus to replicate, but it also shapes the immune cell function and the immune system response, thus dampening down the fever, especially a low-grade fever, is not an optimal therapy. We can look at other heat therapy things, and I'll just very briefly. We have quite a bit. This is about how much I have on heat therapy. You can just see there's a lot. We don't have time to cover it all. But going back to the different types, how do we deliver the heat? Now, this heat therapy was actually studied in phase 3 infections by Dr. Roger Schwelp in Southern California, who's a ICU doctor down there. It's more effective in phase 1. However, I'll just leave it at that as far as the phases. Regular sauna bathing and the incidence of common colds. So we took a look at how fever helps to regulate and modulate some of the communication that happens in the immune system, and also how heat helps to create that very inhospitable environment to inactivate the viruses. So we're going to stay on the topic of heat and look at how can we deliver some of that heat. What are the studies saying about some of the different methods to delivering that heat? This is sauna bathing and the incidence of common colds. So they took 25 volunteers and submitted them to sauna bathing with 25 controls abstaining from or comparable procedures. So this was a randomized controlled trial. Both groups, the frequency, duration, and severity of common colds were recorded for 6 months. There were significantly fewer episodes of common cold in the sauna group. It was found particularly during the last 3 months of the study period, when the incidence was roughly halved compared to the control group. So this is essentially saying those subjects in the study that were taking the heat through the sauna bath, they had half as much incidence of common colds as the control group. And this has to do with the mechanisms that we just talked about: the immune system, communication modulation, and the inhospitable environment that the heat creates. So frequent sauna bathing may reduce the risk of pneumonia in middle-aged Caucasian men. This is a cohort study They were trying to assess the association of frequency of sauna bathing with risk of pneumonia. And the conclusion, frequent sauna baths is associated with reduced pneumonia risk in middle-aged male Caucasian population. Now, the conclusion of something like this would say, and we need more studies to see if it works with other people. Well, more studies, I'm not against more studies, but in the case of COVID, we don't have time to wait for all these studies. We've seen that with other therapies that have been rolled out. And why not just start doing this? Now, not everyone has a sauna, so there's some logistical reasons there. We're going to keep looking. There's more, not just about sauna. This is the effect of cold showering on health and work, a randomized controlled trial. So the aim of the study was to determine the cumulative effect of a routine hot to cold shower on sickness, quality of life, and work productivity. So you don't have to have a sauna, you can just do a hot to cold shower. That's hot for 1 or 2 minutes and then cold for 30 seconds, and then repeating that alternation 3 times. So the results, 79% of the participants in the interventions group, that's the group doing the hot and cold showers, they completed 30 consecutive days protocol. And there was a 29% reduction in sickness from hot to cold shower regime compared to the control group. So 29% reduction in illness or in sickness just from a hot and cold shower. This is, your body's not making a fever response because you're not that sick, but just doing the hot and cold shower, just doing the sauna bathing is going to help you, prevent you from getting sick in some cases. It's going to increase your chances. Frequent sauna bathing may reduce risk of pneumonia in middle-aged Caucasian men, a cohort study. Now, we don't have time to go through this one. You guys get the point of some of the heat delivery. Now, I want to, the sauna, the thing about a sauna and a hot shower, the heat delivery there is not just topically through the air or through the water directly in contact with your skin. The heat there is inhalation heat. You're breathing in, especially in a sauna, and that's one of the best things that can be done with COVID is breathing in that hot air, because a lot of times that dry heat, the temperature of that dry heat is going to be way more than the 40 degrees Celsius that we talked about earlier. That 40 degrees Celsius is that level where the virus is inactivated. So if you're breathing in sauna air, which is much higher in temperature typically than 40 degrees, you're going to be inactivating any viruses that are in your bronchus, in your lungs. And that's one of the reasons why these studies find that there's such a reduction in illness with those who are doing the sauna bathing. And if you look at, for example, Sweden is a country that sauna bathing is just part of their culture, really. Sweden overall, my understanding is they didn't carry out a lot of the masking, the lockdown type of things last year, and they were expected to be among one of the places with the highest rates, highest problems, and they certainly were not hit as hard as other places like New York City, Italy, things like that. So, and then that simply has to do with partially. There's a lot of other factors that go into it, of course, but that partially has to do with their cultural practice of sauna bathing. The virus cannot exist. Viruses can't replicate without a host, and so if the viruses that are on the surfaces got there from a host expelling them out somehow, and if you ingest them or inhale them and you're going in a sauna every 2 days, the virus isn't going to have much time to start replicating. And then when you breathe in that hot air is going to basically inactivate the virus and make it to where it's no longer a threat. So we'll move on, talk a little bit about, well, one more Finnish sauna on white blood cell profile and cortisol levels in non-athletes. We'll just look at this part. Sauna bathing caused higher body mass loss and plasma volume in athletes compared to the group of non-athletes. After a sauna session, an increased number of white blood cells, lymphocytes, neutrophils, and basophil counts were reported in the white blood cell profile. Now, this was comparing athletes and non-athletes. The non-athletes didn't have as good outcomes with this. And that brings us to our next topic, which is exercise. But even the non-athletes had some benefit from it, but those who were more physically fit had a greater benefit from that as far as their white blood cell count and so forth. So we're going to look at, we're going to try to get through all of this. It's way too much to cram into this time frame. So upper respiratory tract infection is reduced in physically fit and active adults. We're not going to spend a lot of time on this. Everybody knows exercise is healthy. Everybody knows if you exercise, you're not going to get sick as much. But this study, the results, the number of days with upper respiratory tract infection during a 12-week period was significantly reduced 43% in subjects reporting more or equal to 5 days a week of aerobic exercise compared to those who were largely sedentary. So they just looked at two groups of people, one sedentary, one that was, well, they looked at multiple groups depending on how much exercise they were doing. But those who exercised at least 5 days a week, 43% reduction in upper respiratory tract infection. So not much more to say about that. We all know exercise is healthy. We all know we should do it more. That's something I'm trying to do more of. Last week I started exercising again. I hadn't been exercising for months. I wasn't exercising when I came down with COVID. I wasn't getting very much sleep. I was getting about 4 hours of sleep a night, partly because I was working on this presentation. However, exercise is something that I would encourage everyone to do. And if you have something fun, do something fun. Then it doesn't feel like you're having to work or work out. It just feels like something fun. This one is more along the lines of how can you decrease the viral load that your body is handling. If you decrease that viral load, it stands to reason that your duration of illness and your severity of illness would be lower. And this is out of a Japanese dental science review. If there's any dentists in the group, I'd be interested. What are you doing in your practice? What did you implement in terms of infection control measures? Are you having your patients do a povidone iodine gargle or mouth rinse before their dental appointments? There's no huge COVID-19 outbreaks that I've heard of that have been traced back to dental services. And so there must be some effective measures. And I believe this is one of them, certainly not the only one. But this looked at how povidone iodine gargling mouth rinse can inactivate SARS CoV-2 and decrease the risk of nosocomial and community transmission. Nosocomial is inside the hospital. community is obviously not inside the hospital. This is an evidence-based update, and this really makes a lot of sense. Povidone iodine is used in, I mean, I can think of a lot of different settings that it's used in. Surgical setting, we don't use an iodine scrub anymore on the skin, but we use chlorhexidine gluconate when we're doing any needle punctures, things like that. So cleansing the skin with iodine is something that is done frequently. Doing that rinse in your mouth to decrease the viral load just makes sense. One of those things where we don't really need a study, but it's one of the most simple and cost-effective measures that can be adopted by the public and healthcare professionals to prevent cross-contamination and community transmission. The other thing that I have not seen the studies myself, but other doctors that I trust, I've heard talking about studies that were done with instead of the povidone iodine, they were just done with Listerine. You could probably, it probably didn't have to be Listerine, but that's what the study was done on. I haven't actually used this. It's been expired since about 2015, but it'll probably still be good. So you can decrease that viral load in your mouth, whether you have an active infection or whether you think you might have been exposed. So where are we at? We've gone through a lot of these so far. We're going to talk about rest, and we're going to talk about sleep robbers. We still have to talk about a lot of different things, and we've already are over our time. But sleep, I'll just look at this one real quick. This is I wasn't able to pull this up online because the online version was no longer available, but this is effect of sleep deprivation on response to immunization. This particular study, they looked at 2 different groups of people. This was a randomized controlled trial. They looked at 2 different groups of people. I summarized it here in the PowerPoint because I couldn't bring it up online. They had 2 groups. They had the test group and the control group. The test group was sleep deprived. They were not allowed to go to bed when they wanted to. They had to go to bed at as early as 1 a.m. or as late as 5 a.m. for 6 nights. And after the 4th night, they received a flu vaccine. The antibody titers were measured in both the sleep deprived group and the control group. And they measured these antibody tests at baseline, at day 10, day 20, and day 30. The average or mean antibody titers in the sleep debt group at the 10-day mark was less than half of those in the control group. So if you're sleep deprived and you're infected with COVID or infected with the common cold or infected with anything, or if you have the flu vaccine, your body is not able to mount the amount of adequate response that it normally would, as opposed to if you were not sleep deprived. And you can see the severity of sleep deprivation. There was less than half the amount of antibodies present in the group that was not getting enough sleep. So that highlights the importance of sleep. And this study was done with the thing that was to trigger the immune system was the flu vaccine. But if you're sleep deprived and you get a flu vaccine, and if you're sleep deprived and you actually get a real infection, with the real infection, it's not like your body is going to mount that full response when you're sleep deprived, just like it didn't mount the full response when these subjects got the flu vaccine. So we will continue to power through the rest of this information. COVID-19 mortality risk correlates inversely with vitamin D status. Now, we're moving to this. This is just a graphic of the sleep-deprived subjects, control subjects. We really don't have time to get into that. Half as much antibodies. That's all you need to remember if you're sleep deprived. So, talking about the nutraceuticals, there's 4 main nutraceuticals that are important. There's more that are important, but the 4 that we have time to briefly mention: vitamin D, zinc, quercetin, and vitamin C. Those are the 4. And we are not going to look at studies on all 4. We're just going to look at this one study on vitamin D. Much research shows that D3 levels correlate strongly with SARS CoV-2 infection severity. So the severity of your illness when you're infected with SARS CoV-2 is going to correlate strongly with your vitamin D levels. And what I found interesting about this, the data set provides strong evidence that low D3 is a predictor rather than just a side effect of infection. So in this, we go down here to the results. There was a specific part here. Here we go. The correlation results in table 4, in which the combined data shows significant negative correlation. Let's get this so we all can see. This is the correlation here. So we have the mortality coefficient and the vitamin D level. So as we move from left to right on the vitamin D, the lower axis, we see that the mortality risk goes down. The linear regression results can be found in table 5. The regression for the combined data intersects the D3 axis at 50 nanograms per ml, suggesting a theoretical point of 0 mortality. Now, we know 0 mortality is not, that's not attainable, but what they say here, now this study was done at the time when the vaccination was not yet available. Patients with sufficiently high D3 serum levels preceding the infection were highly unlikely to suffer a fatal outcome. Highly unlikely. So if you have adequate vitamin D levels, you will be highly unlikely. Now, this was a group, again, this was before the vaccine was available. They were looking at this. This correlation should have been good news when the vaccine was not available, but instead was widely ignored. still widely ignored. However, it's highly unlikely that you will suffer a fatal outcome if you have adequate vitamin D levels. Now, in conclusion, we've just scratched the surface on all of these. I mean, we really didn't get into a lot of these. We didn't even talk about trust in divine creator. We won't spend a huge amount of time on that, but I do have to mention one thing. This is what I mentioned in part 1, Handbook on Religion and Health. This is coping with stress. There's also chapters about the immune system. This just briefly says, religion is a powerful coping behavior that people at all times and in all places have used to deal with suffering and adversity. The explanation is for why there's a link between religion and physical health. Many originate from the fact that religious beliefs and behaviors enable people to cope with stress and thus buffer stress's negative effects on physiological functions. So the religion and health connection is that stress's negative effects, particularly in the infectious disease context, that buffers stress's negative effects on the immune system specifically. And since we're talking about the context of infectious disease and COVID, it's very important that link between too much cortisol or high levels of cortisol and immunosuppression is very strong as well. So I just had to mention that. So in conclusion, I'm going to just talk about the power of combination therapy. That's not really, it's not really a specific term, but I'm just using that to describe combining all of these therapies together. We saw with the study about exercise, there was a 43% reduction in upper respiratory illness. We saw vitamin D levels, highly unlikely to suffer a fatal outcome from COVID-19. So if you did just exercise, you're gonna reduce your risk. If you added vitamin D levels, making sure you have adequate vitamin D levels, if you did both of those, your reduction in risk is going to be you're going to have more of a reduction than if you're just doing one. That's kind of an obvious conclusion. Now, we can't really estimate how much more reduction unless we do studies on that, randomized controlled trials. But again, we don't have time for that. Hot and cold showers, 29% reduction in sickness. We saw that one. Zinc, we didn't even get to look at any studies on zinc. Quercetin. Zinc is what helps kill the virus. Quercetin is what helps get the zinc into the cells to kill the virus. So they kind of work together hand in hand. Quercetin, one dietary source of quercetin is apples. I have to mention apples since we're in Washington State. Vitamin C, very important for the immune system. So if you just did one of these, you can see how powerful some of these are. If you just did one of these, you're going to be way better off. If you exercised 5 days a week, you're going to be way better off. If you did vitamin D checks and got your vitamin D up to a good level, if you just only did that, you're going to be way better off. If you did all of these things, then your chances of having an adequate immune response, an optimized immune response in phase 1 when it's most important, chances of that are going to be extremely high compared to if you're not doing any of these. We didn't even look at we looked at sleep, but we didn't even talk about the sleep robbers. The two biggest sleep robbers: caffeine, screen time before bed. I struggle with one of those a lot, and I'm just saying, cut out caffeine, cut out screen time before bed, and your chances of getting a severe course of COVID are going to be reduced. Interestingly enough, with the hot and cold showers in that particular study, it talked about the participants reported energy. I'm not going to take the time to find it, but the participants reported an increase in energy after the hot and cold showers, similar to what they felt like when they used caffeine. So if you want to get off of caffeine 100%, when you go through withdrawals, when you're going through that low, hot and cold showers can be a huge thing to help with that and help your body restore and reset and regather its bearing to energy from your natural sources instead of drug sources. We missed going over those sleep robbers. We talked about heat therapy, sauna therapy. So if you did all of these things, you would be very, very well positioned to lower your risk. But like we saw in the vitamin D study, these are largely ignored. And one of the reasons they're largely ignored is because it's a lot easier to pop a pill. It's a lot easier to go get a shot. It's a lot easier to do things that are just a one-time quick type of fix. And I would encourage you to do as many of these things as possible so you can lower your risk. I work in a high risk setting because I'm with COVID positive patients every single day that I'm working. ICU, ER, some of them are being ruled out, or some of them have not had a test yet. So if you're in a high risk setting, especially do everything you can. I've been since I got COVID and I have immunity now. I've done a few nursing house calls, actually educating people on these things and telling them the options that they have. I'm not telling them what to do. I'm not prescribing anything to them. I'm saying, look, these are things that science has shown to be effective. These are things that science has shown to be powerful. And if you want to stay out of the hospital, then you could think about doing as many of these as possible. And there's many more therapies. We talked about how we're just scratching the surface with these therapies. There's many more therapies that we don't have time to go over, but these simple ones are enough. You really don't need a lot more than this. We didn't. There's enough talk going on about the vaccine out there. There's enough information about that. There's enough information you could say about other therapies like ivermectin and hydroxychloroquine. The problem with all those, whether you're talking about hydroxychloroquine, ivermectin, or the vaccine, I really don't care. The problem is you need a prescription for some of those. Sometimes they're not available, whether it's the vaccine, whether it's hydroxychloroquine, whether it's ivermectin. And I'm not even talking about the efficacy of any of them. They're on different polarizing ends of the spectrum. But the problem with those is they're not always available. They're not. You can't always get them when you want them. And I'm not saying that you want one or the other or both, but doesn't matter which one you see as being most helpful. The drawback to those is they're dependent on the supply chain. They're dependent on a lot of other things that are beyond our control. And with this pandemic that we're in, we really need to focus on the things that we can control and things that we can implement, and the things that are simple, effective, and that things that are less dependent on the supply chain. As long as you have a home that has hot water, you can do hot and cold treatments. As long as you have access to healthy food, you can get a lot of these nutraceuticals in whole food form. And you can ramp it up by buying some supplements, but again, that's dependent on the supply chain. But you aren't dependent on the supply chain to get rest. You don't have to depend on the availability of sleep to improve your immune system. Just turn off your phone, quit drinking the coffee, replace it with peppermint tea or something. So in conclusion, I believe that every good gift is from our Creator God above. And the good thing about this is, if your worldview includes religion, if your worldview includes a loving God, or if your worldview doesn't include a loving God, these are still going to be effective. You don't have to be a religious person to benefit from these natural health laws that I believe God has created. And they're so simple. They're for everyone. You don't have to have a lot of money. They're just so effective too when you combine them all together. Now, I would encourage you to make some goals. Get out a pen right now, make some goals, write down some of the things that you're going to change today, tonight, or tomorrow, regarding what you're going to do. It's going to be hard to implement 100% of these things all at the same time, but choose 3 things to focus on throughout the day today. And then the next day, add one more thing each day, and you will be well on your way to positioning yourself for better health, more optimal immune system function during this time. And I mentioned earlier that these will become more important with time, these natural therapies. If you remember back in about 2014, we had the Ebola scare. Let me just get back to the Zoom screen. One of my old teachers, Dr. David DeRose, wrote a great book called Evading Ebola. Dr. David DeRose, great book. I would recommend it. I don't know if the next pandemic is going to be Ebola. I don't know if it's going to be smallpox. I don't know if it's going to be Omicron. We're already hearing about Omicron. It doesn't really matter what it is. Now is the time to learn about how to optimize your immune system. Now is the time to learn about simple, effective methods that have been researched in the medical literature, that are not dependent on the supply chain, that are not expensive, that are accessible to anyone, and that are things that you can go do and educate your loved ones on, and you can help them with heat therapy when they are sick. Now, back in 2014, this is Nature magazine, one of the well-known scientific journals. This particular issue was about the Great Depression, about the Depression pandemic. And what I want to show you is this here: UK strategy in Sierra Leone, community units corral Ebola contacts, epidemiology. This particular article, I'm going to read a section of this. Tough choices to reduce Ebola transmission. So the Ebola outbreak in West Africa is larger than all previous Ebola outbreaks. Transmission in dense urban populations presents challenges never before seen. Vaccines and drugs would offer a complementary approach to control, and they must be fast-tracked. We saw the same problem with this pandemic. They were fast-tracked, but there's still that time, that phase where they're not available. So it says, but these medicines are not available for immediate widespread use. We had the same problem in this pandemic. To quell this unprecedented outbreak, we have to use methods that have not been tested. And the article goes on to talk about these methods that have not been tested. Tough choices to reduce Ebola transmission. They're talking about quarantine camps. Back in 2004, the UK was doing this in Sierra Leone. They were using quarantine camps to geographically consolidate people who were sick, to quarantine them from other areas in the cities. So number one, don't live in a city. Number two, that's kind of impossible for most of the population of the whole world. Number two, we don't need quarantine camps to send sick people to. We don't need to localize geographically a camp for people to recover. If you look at all of these therapies that we've looked at, the best place where you're going to be able to do them and implement them is at home. Quarantining at home is all we need. We don't need camps for people to go to. And I say that specifically because of what's been happening in Australia with the quarantine camps there. I don't foresee the quarantine camps happening here in the United States for a number of reasons. But the best place to quarantine is at home, where you can implement all these things that are going to help you get well. We don't need to have camps and be sending people to quarantine camps for COVID when they wouldn't have the resources they need to implement all of these effective therapies that have been researched. We don't need, the article said we need to implement things that haven't been studied. No, we need to implement things that have been studied, that have been shown to prevent disease, things that have been studied and shown to reduce severity of illness, things that have been studied and shown to reduce the duration of illness. Those are the things that we need to be doing at home. And with that said, I will bid you good night, and I wish you the best in implementing all of these therapies. If there's any questions, reach out to me via email. I'm happy to answer any questions. Happy to continue this dialogue. Take care and good night.